Hello, and welcome to today's presentation. My name is Heather, and I'm with the Nevada Primary Care Office. This presentation should give you a general overview of some opportunities available to those interested in professional training and placement serving Nevada's underserved population through loan repayment and scholarship program opportunities offered through the Health Resources and Services Administration, known as HRSA, the Bureau of Health Workforce, known as BHW, and National Health Service Corps, known as NHSC, in state of Nevada, and equip you with the basic knowledge and tools to help you navigate the options and get started. What is HRSA and BHW? HRSA's mission is to improve health outcomes and address health disparities through access to quality services, a skilled workforce, and innovative, high-value programs. HRSA does this through grants and cooperative agreements. The Primary Care Office, known as the PCO, is funded by federal grants from HRSA to support multiple programs and serve as a liaison to assist with recruitment and retention efforts of healthcare providers based on federally designated health professional shortage areas and work in collaboration with other partners and stakeholders. The NHSC was created in response to the healthcare crisis that emerged in the U.S. in the 1950s and 60s, when retiring physicians left many areas of the country without medical services. They want to improve the health of underserved and vulnerable populations by strengthening the health workforce and connecting skilled professionals to communities in need, including rural and underserved areas, behavioral health services, and substance use disorder. 28% of the BHW funding supports the NHSC and other programs that improve the distribution of health professionals to underserved areas. And here are some of those programs. So what is a health professional shortage area known as a HRSA? A HRSA is a designation. Many federal and state programs use HRSA designations in determining eligibility. Throughout the U.S., there are geographic areas, populations, and facilities with too few primary care, dental, and mental health providers and services. HRSA works with the state partners like the PCO to determine which of these should be shortage designations and are therefore eligible to receive certain federal resources. The scoring criteria are common across all HRSA disciplines, with scores ranging from 0 to 26, with 26 being areas of the highest need. HRSA scores are updated every 3 years. NHSC and Nurse Corps clinicians must complete their service obligation at approved sites with the HRSA designation. Here you can see the programs that use a primary care HRSA, which include the NHSC, Nurse Corps, Indian Health Service Loan Repayment Program, Centers for Medicare and Medicaid Services Bonus Payment, and Rural Health Clinics programs. Nevada has many shortages throughout the state and needs more practitioners to fill these gaps. As you see, less than 50% of the need has been met. Here are the dental care programs that use HRSAs. Only 32% of the need has been met here. Here are the mental health programs that use HRSAs, with only 35% of the need being met. As you can see, each discipline has programs that use HRSAs, and the need for more practitioners in this state is great. So, how has the NHSC impacted Nevada? On October 15th of 2020, the U.S. Department of Health and Human Services, Health Resources and Service Administration announced nearly $500 million in awards to support, recruit, and retain qualified health professionals and students through its NHSC and other workforce development, loan repayment, and scholarship programs. NHSC and Nurse Corps clinicians have been heroic frontline providers in high needs, rural, urban, and tribal communities for decades, and their service has only proven more essential during the COVID-19 pandemic. In 2019, almost $3 million was awarded to 47 NHSC loan repayment recipients and 3 scholarships. With the new programs introduced in 2019 and 2020 resulted with 154 total recipient awards in Nevada across all the NHSC loan repayment and scholarship programs. In 2020, 154 clinicians were recipients of the NHSC Loan Repayment, State Loan Repayment, Scholarship Program, or Student to Services Award in the following fill strengths listed above. 93% of NHSC members continue to serve in areas of greatest need up to 2 years after completing their service obligation. At end of year 2020, there are currently 150 NHSC approved sites throughout Nevada. Approximately 36% of NHSC placements nationally in fiscal year 2019 were in facilities that served rural areas. So what does all this mean? These steps should help guide you. You need to do the research to determine what commitment is best for you, like whether loan forgiveness versus loan repayment, location of work, pay, what are your must-haves, what are you willing to negotiate, or what are you willing to forego. Once you determine that you're an eligible applicant for a program, you'll need to research and read the application guidance. You'll need to ensure you have qualifying educational loans for loan repayment, and there is no double dipping. Each program varies. Above are the basic eligibility requirements for the traditional NHSC loan repayment program. The NHSC seeks clinicians who demonstrate a commitment to serve the nation's medically underserved populations at NHSC approved sites located in HRSAs. NHSC approved sites provide care to individuals regardless of ability to pay. Currently, there are over 17,740 NHSC approved sites nationwide. Eligible sites include federally qualified health centers known as FQHCs and FQHC lookalikes, American Indian and Native Alaskan health clinics, rural health clinics, critical access hospitals, and hospitals managed or owned by the Indian Health Service known as IHS, school-based clinics, mobile units, free clinics, community mental health centers, state or local health departments, community outpatient facilities, federal facilities such as the Bureau of Prisons, U.S. Immigration and Customs Enforcement, IHS, and private practices. If the place you work or want to work is not listed in the HRSA database, then have no fear because it's possible that your location has been overlooked, but it could be eligible to receive the designation. You can work with your local state PCO office. So what NHSC programs are out there? This section is going to provide you with a brief overview of the programs available. This traditional loan repayment program can award up to $50,000 for 2 years of full-time service tax-free. In fiscal year 2020, $224.1 million was awarded nationwide, providing 4,280 new awards and 2,355 one-year non-competitive continuation awards to clinicians working in primary care medicine, dentistry, or as a nurse midwife, physician assistant, or nurse practitioner at an NHSC approved site in exchange for serving in areas of greatest need. As a participant, you are eligible to extend your contract annually until your qualified student debt is paid. This program is open to licensed primary care, medical, dental, and mental and behavioral health providers who are employed or seeking employment at approved sites. Providers receive loan repayment in addition to a competitive salary from their employers. Providers find a job at an NHSC approved site, then apply to the NHSC for loan repayment. In particular, the NHSC has partnered closely with HRSA-supported federally qualified health centers, those FQHCs, to help meet their staffing needs. Over 60% of NHSC clinicians serve in health centers around the nation, and 15% of clinical staff at FQHCs are NHSC clinicians. Introduced in 2019, the NHSC Substance Use Disorder Workforce Loan Repayment Program can award up to $75,000 for 3 years of full-time service tax-free. These expanded efforts help recruit clinicians who are highly qualified to treat opioid addiction. In fiscal year 2020, $77.2 million was awarded nationwide, providing 1,206 new awards to clinicians directly involved in the treatment of substance use disorder and the recruitment and retention of health professionals needed in underserved areas to expand access to SUD treatment and prevent overdose deaths. NHSC SUD Workforce LRP offers awards to providers who use evidence-based treatment models to treat substance use disorders. Evidence-based SUD treatment contributes to combating the epidemic through specific eligibility. Providers must be trained and licensed to provide said treatment at NHSC-approved, evidence-based said treatment facilities. The NHSC Rural Community Loan Repayment Program can award up to $100,000 for 3 years of full-time service tax-free. This program is designed for providers in rural communities working to address the opioid crisis. In partnership with the Rural Communities Opioid Response Program, providers at participating locations are eligible to apply for this program. The NHSC said Workforce LRP and NHSC RC LRP programs are now supporting more than 2,800 providers nationwide. Overall, 1 in 3 NHSC clinicians serve in rural communities. Expanded efforts to recruit clinicians who are highly qualified to treat opioid addiction. This past year saw a 63% increase in awardees, from 512 to 832, with Data 2000 waivers, demonstrating that they are trained in a comprehensive approach that incorporates medication and behavioral health counseling. NHSC offers free training to eligible disciplines, including medical students, to obtain a Data 2000 waiver, which allows healthcare providers to deliver medication-assisted treatment to help address the opioid crisis and become more competitive for some NHSC funding opportunities. This new substance use disorder treatment and recovery loan repayment program is anticipated sometime this year and will offer new opportunities. The types of disciplines are expanding to include behavioral health paraprofessionals and clinical support staff, and will include some new site types not seen before. Keep an eye out for the release of this new program as we see what the application guidance entails. Remember to subscribe on the NHSC website to be the first to know. In fiscal year 2020, $60.2 million was awarded nationwide, providing 251 new awards and 12 continuation awards to students pursuing primary care training leading to a degree in medicine or dentistry, or as a degree as a nurse midwife, physician assistant, or nurse practitioner in exchange for providing primary health care services in areas of greatest need. Scholarships are awarded each year to students pursuing primary care careers. In return, students commit to serving for 2 to 4 years after graduation and completion of training. In fiscal year 2020, $17.3 million was awarded nationwide, providing 148 new awards. This program provides loan repayment assistance to medical and dental students in their last year of school in return for their choosing primary care as a practice focus and working in rural and urban areas of greatest need. The NHSC S2S LRP provides loan repayment assistance of up to $120,000 to allopathic and osteopathic medical students and dental students in their last year of school in return for a commitment to provide primary health care in rural and urban HRSAs of greatest need for 3 years. This program was established with the goal to increase the number of physicians and dentists in the NHSC pipeline. In fiscal year 2020, $1.1 million was awarded, providing 20 new awards to health profession educators from economically and environmentally disadvantaged backgrounds in exchange for serving as a faculty member in an accredited and eligible health profession school. The program also encourages participants to promote careers in their respective healthcare fields. The program pays up to $40,000 of the participants' student loans and provides funds to offset the tax burden. Employing institutions must match the award one-to-one with cash funds unless the employer has been approved for a match waiver. This benefit program is quite powerful and encourages more working healthcare professionals to become healthcare faculty members for those who are willing to serve in eligible faculty roles in their area of specialization for a period of 2 years. HRSA awarded over $18 million to 41 states, Washington, D.C., and 1 U.S. territory as part of its NHSC State Loan Repayment Program, which provides cost-sharing grants to states and territories to operate their own loan repayment programs. The NHSC State Loan Repayment Program was created to designate areas of underservice within the state and match practitioners to those areas of need. A practitioner may enter the NHSC by engaging in full-time clinical practice in an assigned community in exchange for loan repayment funds. The funds must be matched dollar for dollar from non-federal contributions from public or private entities for every $1 you receive in federal funds. This program offers loan repayment to primary, medical, mental, behavioral, and dental healthcare clinicians working in health professional shortage areas. A practitioner may enter the Pennington Rural Health Service Loan Repayment Program by engaging in full-time clinical practice in an assigned community in exchange for funding used to repay qualified educational loans. Funding under this program will be provided by the William N. Pennington Foundation. This program will allow Office of Science, Innovation, and Technology to fill critical healthcare workforce needs in underserved communities throughout rural Nevada. This one-time funding will fund approved applications for eligible full-time clinicians until the funding runs out and includes disciplines such as comprehensive medical imaging and diagnostic medical sonography that are typically not seen in any other loan repayment opportunities. Applications are being accepted on a rolling basis. Now to talk about the Nurse Corps programs. In fiscal year 2020, $51 million provided 465 new awards and 291 one-year continuation awards to nurses in exchange for a commitment to serve at a healthcare facility with critical shortage of nurses or serve as nurse faculty at an accredited school of nursing. Of these awards, the program provides 41 new awards and 27 continuation awards to nurse faculty who teach registered nurses or advanced practice nurses at eligible public or private schools of nursing. Nurse Corps Loan Repayment Program puts registered nurses, including advanced practice nurses and nurse faculty, on a rewarding career path while paying off 60% of their unpaid nursing student loans in just 2 years and an additional 25% of the original balance for an optional third year. These funds are not exempt from federal income tax and employment. In fiscal year 2020, $26.4 million provided 244 new awards and 13 continuation awards to nursing students in exchange for a commitment to work at least 2 years in a facility with critical nursing shortages. Nurse Corps Scholarship Program, which began in 2002, awards scholarships to individuals who are enrolled or accepted for enrollment in an accredited school of nursing in exchange for a service commitment of at least 2 years in a critical shortage facility after graduation. The Nurse Corps Scholarship Program awards reduce the financial barriers to nursing education for all levels of professional nursing students and increase the pipeline of nurses who will serve in the critical shortage facilities. In fiscal year 2021, HRSA plans to continue directing up to 20% of scholarship awards to nurse practitioners specializing in psychiatric mental health with the goal of leveraging HRSA funding to address the opioid crisis. So what tools are out there to help you search for these jobs? The Health Workforce Connector is a free tool to allow you to personalize your profile, search potential sites and available opportunities in approved healthcare facilities in rural and underserved communities. You can also attend the free virtual job fairs where clinicians and trainees go to learn about medical, nursing, dental, and mental and behavioral health job openings, where you can learn more or interact with those sites directly. 3RNet is another great tool where you can register for free to search jobs in rural and underserved areas and get unbiased information from other members on jobs, loan repayment, and insights to the local communities. And here we're going to talk about some other opportunities here in Nevada. The Nevada AHEC Scholars Program prepares K-12 students for future leadership roles in healthcare through interdisciplinary training and provides networking opportunities with potential for career advancement. Nevada AHEC scholars commit to a 160-hour, 2-year learning program with a defined set of clinical and non-clinical, didactic, and community-based activities and/or projects with a focus on leadership development. IPE credit may be awarded by enrolled institutions, stipend upon program completion milestones. The Nevada AHEC is a program of the Office of Statewide Initiatives, University of Nevada, Reno School of Medicine. The Nevada AHEC Scholars Program is nationally funded by the Health Resources and Services Administration, aimed at strengthening the healthcare workforce across the state in collaboration with Desert Meadows AHEC in Las Vegas, High Sierra AHEC in Reno, and Frontier AHEC in Elko. Western Interstate Commission on Higher Education, also known as WICHE, allows college student exchange program that reduces the cost of tuition and select high-need healthcare fields. In return for funding, participants must work in their field of study in Nevada for the number of years they receive support. State Emergency Register Volunteers, or otherwise known as SERV-NV, shows recent experience with large-scale disasters has consistently shown that an effective response requires that volunteers be pre-credentialed and deployed through a coordinated effort. Well-meaning but unaffiliated volunteers who spontaneously present to disaster sites are often unable to be assigned. With limited time and resources to process volunteers, often only those with known credentials are permitted access to the disaster response. By registering with the site, you can be part of an alert system and respond when activated to a significant disaster or public health emergency. The site serves to improve volunteer coordination during an emergency. Here you will find the contact information, some resource links to the information that we discussed, and some acronyms that we use throughout the presentation. If you would like more information or have any questions, please contact the appropriate representative here. Thank you for watching this presentation and hope it helps provide you with the basics to finding the opportunity that is right for you.